in this video we're going to be manual muscle testing and lengthening the upper trapezius muscle. So the upper trapezius has a fairly complex action working at multiple joints between the shoulder and in the neck here. So we're going to go through our explanation of scapulothoracic motion first. So it's going to be doing three things. One of the first things it's going to be doing is elevating, but at the same time it's going to be doing some upward rotation, bringing that acromion towards the ear almost. And at the same time there might be a slight bit of retraction. That's again the minor action in comparison here. So elevation, upward rotation, slight retraction of the scapulothoracic joint. The secondary action is going to be happening in the neck and in the head. Since our origin was off the occipital bone here, we're going to be trying to bring that closer towards the acromion process. So we have several actions that are occurring at both head and neck. So one of them is going to be a lateral flexion of both head and neck. There's going to be a slight extension of head and neck, and there's going to be a full contralateral rotation of the head and the neck. When we add the secondary scapula together, you're basically trying to bring the EOP and the acromion together. So let's go through that once or twice just to make sure our partner is aware of that action. And then he's going to be doing that on his own in a second here. Good. All right, so he's very comfortable with that action. Let's get him to do it by himself for a ROM. Good. The major action is elevation of the scapula, which is why we're doing this in a seated position against gravity. Now I'm going to bring him part way through this action. And again, this is a little bit of a complex two-hand resistance. So it needs to be enough space for you to be able to have your hands in there. With one hand, you're going to be pushing down on that acromion process. And with the other hand, you're going to be trying to do two things. You're going to be pushing away, which is primary lateral flexion, plus you're going to try to rotate, bringing the head towards them, which would be ipsilateral rotation. So I'm going to say, please don't let me move you. And again, I'm going to push with both hands, but primarily with the shoulder hand, since it's an elevator. Good, and that was a good 5-second contraction. I'm going to leave my hands in the same position, and I'm going to ask him to try to bring his acromion towards his, EOP towards the acromion. Let's do that one more time, all the way through. Good, and there is our concentric action. Now for our lengthening purposes, we're going to be trying to hold this scapula down. So that's part one. It's in a downwardly rotated position and it's depressed. And then with the head, we're going to try to, again, capital and cervical flexion. We're going to laterally flex away, and then we're going to try to ipsilaterally rotate, bringing that EOP as far away from that acromion as we can. So here is our length position for the upper trapezius. Again, have you practiced that several times? It becomes a little bit smoother. Excellent. And that is going to conclude the manual muscle test and lengthening position for upper trapezius.